Here we'll talk about RCH program, which is Reproductive and the Child Health Program. It is conducted in 2 phases. In the phase 1, it mainly focused on child survival, safe motherhood, and reducing the sexually transmitted diseases and the reproductive tract infections. Whereas in the phase 2, it mainly focused on decreasing maternal mortality rate and the infant mortality rate by decreasing this morbidity and mortality, right, of maternal and the child. So here we'll see the interventions in the phase 1 program. The first one is essential obstetric care, early registration of the pregnancy. What do you mean by early registration? As soon as she is pregnant, you'll register the pregnancy so that she can undergo as many checkups as possible. If there is any complications, we can treat it as soon as possible and we can save the mother's life and the child's life, right? So early registration of pregnancy, and also 3 antenatal checkups, safe institutional delivery, or if in case any home delivery, we'll provide this trained Dais for the safe home delivery practices, and also 3 postnatal checkups. So what are we doing under this essential obstetric care? First, we are registering the pregnancy as early as possible, and then we are doing this antenatal checkups and also postnatal checkups. In between there is a delivery, right? So we are ensuring this safe institutional delivery, or if in case it is a home delivery, we are making sure it could be safe by providing trained Dais, right? So let us see what is the trained Dais. So this scheme is being implemented in the states with the safe delivery rates being less than 30%. So in the states where the safe delivery rates are less than 30%, you are implementing this training of Dais program. What are you doing under this? You are providing one Dai who is trained in providing safe home delivery per one village. So at least one village should have one Dai who is trained in providing safe home delivery. Now coming to the emergency obstetric care. So here first referral units are strengthened with emergency obstetric kits, equipment kits, skilled manpower, trained birth attendant, right? So traditional birth attendant. So under this emergency obstetric care, you are providing this first referral units with some equipments and emergency obstetric kits and all, right? And then here comes the 24-hour delivery service at PHCs and CHCs. These services are made to promote institutional deliveries and also to reduce the morbidity and the mortality resulting from this emergency deliveries. So in case of any emergency delivery, this 24-hour delivery centers will be opened at PHCs and the CHCs, where the pregnant woman can go and have the safe institutional delivery, right? So now coming to the medical termination of pregnancy, under this Act 1971, it is done to decrease the morbidity and the mortality associated with unsafe abortions. So government provides this manpower and equipment and also skilled doctors to perform medical termination of pregnancy. And coming to the next intervention, which is control of RTIs and the sexually transmitted diseases. So NACO named some clinics where you provide treatment for this RTIs and STIs. They named that clinics as Suraksha clinics. So you'll learn more about this in NACP program. So here they will provide you color-coded kits according to the different syndrome, which is known as syndromic approach. So how are you controlling this RTIs and STDs in the case of RCH program? By color-coded kits or the syndromic approach. Coming to the next intervention, which is essential newborn care. So we are doing resuscitation if there is any newborn with asphyxia, and also we are trying to prevent this hypothermia and prevention of infections, exclusive breastfeeding promotion, and referral of any sick newborn to the PHCs or CHCs, and also district hospitals. So under the essential newborn care, you are resuscitating them if there is any asphyxia, and also you are trying to make sure the baby is not going into hypothermia, and you can also place the baby in ICUs if to prevent any infections, and exclusive breastfeeding is promoted, referral of any sick children to the CHCs or district hospitals. So this is being done under essential newborn care. Under immunization, UIP schedule is followed, universal immunization schedule is followed. So if there is any diarrhea cases in the child, we are providing them ORS, which is low osmolarity, and also adding zinc to reduce the frequency and the severity of the diarrhea, right? If in case there is any pneumonia, so we are treating them with cotrimoxazole. It is present in every PHCs and everywhere. So we are treating the pneumonia cases using this cotrimoxazole, right? And also to prevent this vitamin A deficiency in the child, you will provide them vitamin A, which is of oral route of administration. In the 9 months, we are providing 1 lakh international unit of vitamin A. And after 9 months, that is at the 18 months, you are providing 2 lakh international units of vitamin A. And for every 6 months, till the baby is 5 years old, you are providing them 2 lakh international units. So 1 lakh, 2 lakh, 2 lakhs, right? Now coming to the prevention of anemia in the child, obviously you will provide this iron supplementation. If the baby is 6 months to 6 years old, you will provide them 20 mg of iron and 100 mcg of folic acid. If the baby is 6 years to 10 years old, you will provide them 30 mg there is a 10 increase, so 30 mg of elemental iron and also 250 mcg of the folic acid, right? So this is about RCH phase 1. So to summarize the whole thing, under this RCH1 program, we are talking about reproduction, right? So under the reproduction, you're going to remember two things. One is about the mother and second is about reproductive tract infections. So what are we doing for reproductive tract infections? We are providing syndromic approach and the Suraksha clinics, right? And second, we'll talk about this mother. So under the mother, I want you to remember two scenarios where the mother is having this safe delivery and where she is having this complicated delivery. So for the safe delivery, remember this essential obstetric care. So we are registering the pregnancy, we are maintaining this checkups, antenatal checkups, postnatal checkups, and we are ensuring the safe institutional delivery. If she wants to have safe home delivery, we are also providing her with the trained Dais, one per village. Now coming to the complicated pregnancy. So in the complicated pregnancy, we are ensuring there is emergency services available at the first referral unit and also 24-hour delivery services are available at PHCs and CHCs. If she wants to abort, we are also providing this NTP. So under this complicated pregnancy, remember three things. One is emergency and second one is 24 hours and then MTP. And in the word RCH, from the letter C, we are remembering this child importance, right? So here from the word child, we'll remember essential newborn care. Here you will be resuscitating the baby, prevention of hypothermia, infections and promote the breastfeeding. And also you'll treat for diarrhea, pneumonia, anemia and vitamin A, right? So these are the things you have to remember in phase 1. Bye.